Senator Braun, welcome.
Thank you, Madam Chair. And as usual here, I think of any of the committees I serve on and 4 others, you have some of the best topics that are pertinent to, I think, what affects us all in the real world. Prevention, ounce of prevention worth a pound of cure. I took that on as the mantle for fixing healthcare in my own company as a CEO 11 years ago. And when I talked about things like, wellness and prevention, the insurance industry was more interested in remediation and claims processing. So we're on to something here. I guess my curiosity would be, since the portal for most, before they get to Medicare, is through private insurance, I know when we look at all the information we've got currently to try to prevent, we see clusters of diabetes. Of course, we have cancer, we have heart disease, falls, and the prevention of them would not be high on the radar screen. So how do we, and I guess I got a couple questions, and I'll start with Ms. Cameron. When it comes to tools in the private sector, what is our responsibility of kind of putting this out there as something you need to be aware of before you get on Medicare? And other than a BMD, which I know the particularity of what that test says, is there anything through general biometric screenings that would give us as employers the information to say, hey, you may have an issue down the road even though you're not falling currently?
Great. Wonderful question. Thank you. And yes, prevention is truly important. And I believe starting early and educating people in their 40s and 50s about falls prevention and what they can do, particularly around improving balance and strength and continuing, exercise programs, physical activity throughout their elder years, just like Mrs. Demby has been doing throughout her life. Some of the things that employers could look for are chronic illnesses. We know that heart disease, diabetes, arthritis are risk factors for falls, so ensuring that those conditions are well managed from the very beginning is really important. And often the medications that are used to treat some of those conditions can also lead to increased risk for falls, and we're seeing much higher rates of medications being prescribed really across all age groups, but particularly among older adults. So educating people early on, too, about medication side effects like drowsiness, dizziness, visual impairment that can sometimes happen with certain medications is really important from that perspective.
And a standard blood panel test, which is probably the baseline of any biometric screening. We started that when I put in a new dynamic based upon also employees, patients be engaged in their own well-being. I found that so much of our society is fix it regardless of the cost, and we changed that, and it's unbelievable what can happen. My employees have not had a premium increase in 11 years, and people didn't believe me when I ran on that. So it can work, but when things are simple, they work better. And what is the first baseline, other than just observation, that if you have heart disease or arthritis, common sense would tell you you're going to be prone to falling? Is there any simple tool, and does a standard blood test reveal anything? Because that's simple, and you get the results.
Well, we have a tool called STEADY, the Stopping Elderly Accidents, Deaths, and Injuries, and that is an assessment for falls risk that looks at a number of different risk factors. So it's a very comprehensive approach. It's based on some guidelines that were developed by the American Geriatric Society. So that's a great place to start. And there are also functional assessments that can be done to measure a person's strength and balance, for example, that could be started early on. So those are simple things that could be put in place.
Thank you. Ms. Haynes, question for you. Are you aware of any of the major insurers that are going to be, the interactors with us as business owners that have fall prevention as part of what they talk about? We do a lot of things with our underwriters that, looking at what can we do to prevent things. And I don't recall that I've heard much input. Are insurance companies actually talking about it?
Thank you for the question. I'm not aware of any that in the commercial younger population talk about fall prevention. I think to your point about wellness programs and keeping people active and encouraging that kind of ongoing, whether it's a walking meeting or whatever, those are activities that we all need to do while we're still in that population. For Medicare, it's a different story where we do include in, for example, the annual wellness visit, the question about have you fallen? The bee in my bonnet, I guess, in my teams is you wouldn't say, you have high blood pressure, see you. You would say, come back and let's do an assessment and find out what it is. And then you would make a referral to whether it's a PT or an OT, to Senator Collins' point about the home health, homebound benefit being restrictive. We would take those kinds of actions and then refer out, whether it's a community program or a medical intervention.
Thank you.
CMS has a big role to play.
And I would do this as a public challenge to insurance companies, which many senators are wrestling with them and the healthcare industry in total, that there ought to be more awareness of this kind of thing. And just because you don't handle many claims associated with it, because that domain is going to be in Medicare, that doesn't mean you shouldn't be talking about it. Thank you.
Thank you.